Good morning, everyone, and welcome to CertaPay's Coffee Break number 10. And today we're talking about some of the most popular, most frequent scenarios the CertaPay HR team has been dealing with over the last couple of months. In addition, we want to encourage you guys to think about your own scenarios and type them in the group chat as we go along. And add your questions in. We're going to talk about them and answer them all and superimpose the DOL and the EEOC and the PPP and the CDC right on top of it and see how it comes out. So we've got I'm Rachel Camella, your host. We've got Cindy Merkel on the line as our moderator, and I see Claire and Janet and a few other of our HR professionals from CertaPay on the line. So welcome everybody. And I see some of our friends from SGI on the line too. So special shout out and welcome to SGI and to some of our country clubs I see on the line. So we are so glad you guys are all here. And remember, ask the questions. Now's the time to go through these scenarios and see what we can figure out. All right.
Hey, just real quick, Rachel, before you begin, questions are already rolling in the chat box. I promise you, once we get through the presentation, we'll get every one. So don't think I'm not answering you.
Yeah, that's the point for today. We're going to go through all these scenarios, and we may cover your scenario in this example. So as we go through some of these scenarios, you may find yours answered before we get there. So let's just see what we have. So, all right, we've got an employee with a confirmed case of COVID-19. So this one is the easiest one. The employee who tests positive either stays home or goes home immediately. And then that employee will qualify for the FFCRA up to 80 hours of sick pay. Make sure you use the form. If you don't have a form to use, we will send it to you. Anybody who wants any of this information at the end of this, give us your email. We'll get you whatever information you need. So that employee will have up to 80 hours of sick pay to use. Now, quick reminder on that, it's 80 hours. If they're a full-time employee, it's 2 weeks of sick pay, and it's an average pay, average hours. So if somebody normally works 30 hours a week for you, then they're eligible for 2 weeks at 30 hours each week. We can recap that later if we need to, but I think, that's kind of an important point. So next, what are you going to do? You're going to notify the other employees that have been in direct and continuous contact. So we've had a lot of questions where, we had a confirmed case, the employee was in the building, he walked past 6 people, but, was he in an enclosed space? Was he or she in continuous contact with these other employees? It's the direct and continuous piece you want to ask yourself about. Just walked past somebody isn't really going to do you in. That's something, again, a lot of these are conversations, but so if you had employees with direct and continuous contact, so for example, maybe people sat together in a 4-hour board meeting and they were all sitting around the table interacting and working together for a half a day, now we're talking about employees that you would notify. So you're going to let them know that they were in contact with a person who is positive. We want to keep HIPAA compliance and privacy in the front of your mind here, so you don't want to just spill out the employee who's positive. You want to protect that employee. One thing we've seen is that in cases where there's an employee who tests positive, the other employees go directly after that person. So be very careful to protect all of your employees and the privacy of any of these individuals. We don't want any discrimination or adverse treatment because somebody happened to test positive. So notify the employees, let them know. Now let's figure out a plan. Okay, can these employees work from home? So you've got people who were in direct continuous contact. If at all possible, just let them work from home for the next 14 days. Be mindful of symptoms, be mindful of any changes and things that happen. Simple, and you're done. Now let's say some or all are not able to work from home. So now we want to take a look at the CDC guidelines, implement safety measures, implement social distancing, create barriers anywhere that you can. So keep these people maybe isolated in particular areas of the workspace, make sure everybody is utilizing masks and PPE, follow the CDC guidelines for social distance and keeping your environment safe. And that's kind of the line. And then if you have additional employees who test positive, you want to do the same thing. Now, let's say you have if you have several people turning up positive, you really want to review your process. So do you need to consider a full decontamination protocol? Do you need to clean your whole building? Do you need to take some extra steps? Do you need to push everybody out working from home for a couple of weeks and get a clean start? That's something that you want to address if you get to it. All right. So now let's take that line and move it out a couple of steps. Your employee's family member or intimate contact has a confirmed case. So your employee is not the ill one, but their spouse or significant other or roommate has test positive. So now it's kind of the same thing. Can you just have that employee work from home and pay attention for the next 14 days? Do they have any symptoms? Do they have any issues? You know, we can go from there. If the employee cannot work from home, then same thing. Follow the CDC guidelines, create safety protocols in your building and in your environment. Have masks available for everybody. Have this employee in a situation where contact is limited, if at all possible. And then again, pay attention. If there are any symptoms, you want to send people out of the building, out of the way. We have seen some great daily use questionnaires, and we encourage communication. You want to ask people, do you have a fever? Have you had a sore throat? Do you have a cough? Do you have loss of smell and taste? These are the main symptoms, and these are the things that you can ask. Normally, we don't ask these things, but we do right now. So don't be afraid to have a daily questionnaire and ask people to provide you with the information. I think it's more effective to ask a full set of questions than it is to just take somebody's temperature. Because keep in mind, the temperatures fluctuate throughout the day. Temperatures fluctuate throughout any kind of illness cycle. And having a temperature doesn't mean you have COVID. Same on the reverse. Not having a temperature doesn't mean you don't have COVID. So you're better off to ask some questions. And if it's in written format or electronic format, it gives you good information. So pay attention, use that. If symptoms develop and somebody is seeking medical attention, then we go back to the previous slide where FFCRA kicks in. They would be eligible for the 2 weeks of full pay under that program, and you would be eligible to take the tax credit on that. So you have to kind of layer these different things on top until you get to the right answers. And then finally, notify any employees that were in direct and continuous exposure, but that individual isn't positive. So there's no direct and continuous contact with a positive person. You would only do that if the employee then comes down with develops symptoms and is going for seeking medical attention. So think about your different layers as you go through. So this is a good one, like when and how do employees get paid under different scenarios? So your employee has flu-like symptoms and the employer has asked the employee to stay home. The employee was seeking medical attention, got tested 3 days later, and then the lab told them it was negative after 4 more days. So what does that look like? So the FFCRA pay would be in play here because the employee had symptoms and was seeking medical attention. And so for the days they're out, they would be eligible for the FFCRA sick pay. And then At the point when they get the negative results, now you think of the CDC guidelines. Okay, how many days have you been without symptoms? Have you been symptom-free for at least 3 days without medication? So it will be appropriate to return to work after that. So the FFCRA would pay for the days out because they had symptoms and they were seeking medical attention. Now, just because the test was negative doesn't mean they don't get that pay. They would be eligible for that pay, but now that you know it's negative, it's time to get them back in. If they're feeling well, they're symptom-free. But let's say the employee is well but does not feel like coming to work. So this does not automatically mean, whoops, got zipped around. This does not automatically mean they get paid. So just because somebody doesn't want to come in, they have no symptoms, they are not seeking testing, they're not seeking medical care, they're just worried about the environment. So this is a time when you review your CDC guidelines and you look at protocols for your office. Can you set up some checkpoints and questionnaires where people are answer that before they come in? Can you have PPE available to people? Can you set up social distance within your office? So create an environment where your employees feel comfortable and safe. And so that you don't get to this. People are going to say, okay, I know they're trying really hard. They're doing everything they can. They're creating a safe environment for me, so I'm going to go back to work. But if they just decide they don't want to come in, there's no automatic pay for that, because under the unemployment guidelines, they have been offered work, they have work available, they're choosing not to take it. So unemployment would not be available. And the FFCRA has very specific guidelines that connect them to COVID scenarios, and that isn't one. All right.
Rachel?
Are we good? Yes.
Can I ask a question or clarification?
Yeah.
The first bullet, when we're saying that they're seeking medical attention and they are paid, we're not saying they are getting paid just for going to having a test. We're saying they're getting paid because the doctor has told them either to get the test or to stay home?
So if somebody has symptoms and they say, listen, I've got a fever of 101, I've been coughing all night, I am going to be reaching out to my 1-800-MD number as soon as I can today, that employee is eligible. And so they contact their telemed or their teledoc and they say, I've got these symptoms. And then on our forms, we specifically ask that. You can write that in the memo. Who did you speak to? What time was it? What did they tell you? And so you've got information there. They were seeking medical attention, medical advice, even though it was a 1-800 telemed or teledoc. That's perfectly acceptable right now. And that individual has symptoms. They sought medical attention. And then what did the medical care provider tell them? Well, in this case, there's a good chance that medical provider would have said, I think I would recommend that you go get a test and then self-quarantine for the next 14 days. Now, I'm not a medical doctor, so that's not advice that I am saying. What I am saying is that's most likely what's going to happen. And in that scenario, what we know is that's covered under FFCRA. So that is a great example of a case when that individual will be paid. Now, let's say that person goes for the test. It comes back negative. They start to feel better. Now they've been paid for the days under the FFCRA, but now they feel better. It was just the regular flu, and they've been symptom-free for several days, and now they can return to the office. So at the point when it's negative, that's another time for a conversation. Did I clarify that or make it more cloudy?
No, I just wanted everybody to understand the difference between just not feeling that great and going to a drive-through test site versus actually seeking medical attention from a healthcare professional. There is a difference.
Right. There is a difference. Okay. And we covered this one, the employees well. So how about this? My bar has been ordered to close, but I currently have 2 employees out on FFCRA sick leave. So what does that look like? You no longer pay for the employees who are out on sick leave. You're not paying those wages for the people on sick leave, now everybody, including those 2 employees, would be eligible to apply for unemployment benefits. Because at this point, the bar is closed. You are not open and operating. Those employees they don't have the choice to come to work or not. They would be considered laid off, furloughed, bar closed. So they would be eligible to apply for unemployment benefits, including the 2 individuals out on sick pay. That is a question that we get quite a bit. So I know that's one that we've talked about. An employer is temporarily closing due to lack of business. This is another case where if the business is closing, you do not have work available for the employees, they would be eligible to apply for unemployment benefits. All right. Now, this one, we are starting to see because of the simple amount of time that we've been going through this. So I got an employee who already used 80 hours of sick pay due to having COVID symptoms and seeking medical attention back in April. And so this employee already received 80 hours of pay under FFCRA. And now it's 2 or 3 months later and he has symptoms again. He's gone for testing and he's tested positive. What can we do? Well, this employee is not eligible to be paid under the FFCRA program. You are allowed to pay employees whatever you want. If you want to continue paying somebody anyway, you can. You just can't take the FFCRA credit. You can offer, if the employee has PTO available, if you want to allow them to use the PTO, you could do that. You could say, we've got additional sick time in PTO. They're allowed to use that if you decide that. Or you can say, we understand you're sick. You need to stay home, but we don't have any more time to pay you, so that would be unpaid time. So again, this is a situation that's starting to come up now that we've gone through enough time that people have already used up their 80 hours. Are we good?
Yes, we are. Keep going.
Okay. Can I require my employees to get tested as a condition to come back to work? Well, the answer here is yes and no. So yes, you can if it is directly connected to a job description. And within that job description, the virus would pose a direct threat. So in the case of healthcare professionals, in the case where you have direct and constant contact with somebody in the environment. So you have to be very careful about when you say yes. And it's not yes across the board. Everyone here needs to be tested in order to come to work. In fact, I had one of our clients who is has a bar, and they said in order for the employees to work, they all had to be tested. But this is an ADA situation. You want to be careful about making a blanket statement. There's potential discrimination where, you know, you're not allowed to tell somebody what medical treatment they can and cannot get. So be very careful here. It has to be directly tied to a job description where the virus would pose a direct threat to the health of others. So be careful here. And again, CDC guidance is great for these things. It will give you the way to set up, the way to have a safe environment, the way to respond. So be very careful about these things. So no, don't make that blanket statement about all employees getting tested. But if you believe that there's a direct threat situation, then isolate it and tie it to specific job descriptions. What if, this was my party slide, an employee at your company has a small gathering over the weekend at his house, and he has 10 of his favorite coworkers and best friends. They're hanging out, they're listening to music, they're partying for 3 or 4 hours. And then on Monday, that employee comes in with symptoms. On Wednesday, she tests positive for COVID-19. So what do? Well, first of all, you encourage your employees not to have big parties on the weekend with each other. And so this is another one of those questions. What can we tell or ask our employees to do when they're not at work? You can't tell them what to do when they're not at work pretty much at all, but you can make recommendations and you can say, please follow CDC guidance right now. Please practice social distancing when you're not at work. Please remember your mask when you go to Costco or shopping or to any place where there's going to be a gathering of people. So it is okay to make recommendations. One of our coffee breaks with Claire showed all of the ways that you can be safe in home and at work. So I think it would be a great thing to go back and watch again and even share with your employees, because you can say, please follow these other guidelines that will keep us all safe. Now, they may or may not do it. It's up to them. You can't really punish somebody for having a party over the weekend. But then what happens is you end up with other people who test positive for COVID. So we want to eliminate any of those possible scenarios. So encourage people not to gather right now. Encourage people to follow social distancing and safety practices. And then you take a closer look, it's 10 people, and find out, can we get these people working from home for the next 14 days and get this to settle down? And if you can't, anyone who can work from home, that's your best bet. Or if they're working from home, keep them working from home. If you can create some social distance in the work environment, same rules that we've been saying over and over, follow CDC guidance, wear masks, add any kind of process that keeps social distance in the workplace, and that will help keep you safe. And then be mindful, pay attention to, do any of those individuals have symptoms? Use the questionnaire and ask them before they come in each day. Are you, do you have any symptoms? Do you have a fever? Do you have a sore throat, cough, loss of smell or taste? Go through that questionnaire before people come to work, and then keep a close eye on it. Get outside of that 14-day window and then move on. Good? Okay, what if my employee's spouse has a positive case in his office? So now we're getting a couple of layers away. So your employee does not have it, your employee's spouse does not have it, there's somebody in the spouse's office that does have it. So you don't even know what kind of contact the spouse has with his coworker. So we're pretty far removed here. Same things apply. Encourage social distance in and out of work, follow CDC guidelines. All of the employees in this example should continue to work, and use that questionnaire. How do you feel? Pay attention to symptoms that pop up. How we doing? Are we good?
Yes, ma'am. Keep going.
All right. So to throw in a couple of questions that are intertwined with our FFCRA and our PPP, we got the PPP loan and already used all the funds. Now we have an employee who is out with COVID-19 symptoms. So with an employee, we can kind of answer this based on what we already talked about. So you've already gone through your covered period with the loan, and all of your loan dollars were spent on wages and whatnot, appropriate spending. And now you're outside of that window, and so FFCRA is back in play. So if somebody has symptoms, they're seeking medical attention, they're positive, they get a positive test result, FFCRA applies. So they would be eligible for paid leave. And then you would get that credit against your 941. We're in the middle of our covered loan period, and 2 employees test positive for COVID. So this is kind of a tricky one, because the 2 employees would be eligible under FFCRA for that paid leave. So you have 2 choices. You can either carve those wages out of your wages, your total payroll costs for your covered period. So when you're looking at getting your loan dollars forgiven, you can't claim the dollars in two places. So when you're in the middle of your covered period, if you've got two people that you're going to use FFCRA credit on, carve them out of your wage total and separate it so that you can use those wages for these employees to get credits against your 941. Or don't claim them as FFCRA, just keep them as regular wages paid under your covered loan period, and just pay the wages with your loan dollars and claim them as wages paid that would be forgiven. So be careful about double dipping on that. If you are within your covered loan period and you have people out on FFCRA, you will need to carve those dollars out for your forgiveness, or don't claim them as FCRA at all. And that's a little bit of a tricky one. All right, so all of these things that we just talked about, I just carved them into three categories. So we've got paid leave, layoff, and then somebody chooses not to work. So under paid leave, the business is open and operating. You have work available. You want your employees to come to work, but the employee is unable to because of something directly connected to COVID. They're either caring for somebody who's sick, they're caring for a child whose daycare is closed, they are sick themselves, they're positive, all the things that we talked about. That would be paid leave under FFCRA. Now the employee is able to work and willing to work, but is unable to because the business is closed or has been ordered to close. This is considered a layoff or a furlough. And in this case, the employees are eligible to apply for unemployment. And we've had some scenarios where the employees, we've had restaurants that were ordered to close and all the employees are applied for unemployment benefits. And then the restaurants opened back up. So they pulled back the employees who were working and earning wages, and then they had to cut back again. So the employees then had to go back in and claim weeks where they did not have pay. So when the doors are closed or ordered to close, or the business has to tighten up, then the employees can go back and apply for unemployment benefits. If the employee just doesn't want to come in because they're worried right now, or they feel like it's not safe, or any of these reasons, they don't qualify for either one of these paid programs. So they don't qualify for unemployment if they are offered work and don't come in, and they don't qualify for FFCRA because they aren't actually working. You only qualify for FFCRA when you are there working. Documentation is important. We're not saying go ask for doctor's notes and, knock down, drag out, get us proof, but get something. So you can use screenshots and text messages and doctors' names and addresses. You can get information that you can write down on the form. And if somebody is out positive with COVID and has symptoms, you don't want them to come into your building to sign a document, but you can send them the document. Ask them to sign it electronically and get it back to you, or take a screenshot of a text that says, I am acknowledging this is truthful and this is my information, and attach it to the document. With technology, we have excellent ways to create a document trail. So be creative there and make sure you have some backup. CertaPay has an excellent request form. We have daily questionnaires. We have a lot of different things that can help you create backup and create information that you can use. You want to be able to prove what happened, why are you getting credit on the 941? Well, these are the people that I had out on leave. This is what I paid them. Or during the PPP, this is what happened. So you want to have plenty of backup and documentation to show what you did during these times. On the form also, we have an employee truthful statement. So the employee says, I acknowledge that this is true to the best of my ability, and in the event that I'm lying, could result in disciplinary action up to and including termination. So that signature is important. We want to make sure that the employees also are aware that we expect people to be truthful and trustworthy right now. And a lot of it is we do have to dig deep. We do have to trust our employees and understand that there's a lot going on. There are a lot of different situations and scenarios, and people are juggling things in different ways in their own lives right now. We've got people who are caring for people who are sick. We've got kids who are home from school. We've got a lot of layers that everybody's kind of juggling. So, I think it's important to communicate and stick together so we can all get through it. So my final thoughts are, remember that FFCRA is in place all year, and we're going to have so many different scenarios. Remember that CertiPay is here to help you and guide you through this. If you have questions or issues and you're not sure, we are here for you. Document everything. Trust your employees. Communicate. Have an open communication so they feel like they can come to you and tell you what's going on. And as always, do the best you can. There are so many different things happening right now. So just do the best you can. If you're not sure about something, reach out to us and ask, and do the best you can. I know we're going to have questions. So how does it look? Let's flip it to you guys.
I'm ready when you are with what we have. Folks, if you could wait till the end to give me your email addresses, it's much easier for me because I have to toggle back and forth between the questions. So you ready?
I'm ready.
First question. If an employee tells me that a family member is suspected to have been exposed to COVID, but the employee is asymptomatic, should we send them home with pay for how long? Do we require 2 clear COVID tests before testing? So let's back up. If the employee has a family member that has been potentially exposed, should we send them home?
So the family member is potentially exposed.
Correct. Not the employee.
Okay, so this is kind of the scenario right here. This is my employee. So my employee's family member was potentially exposed, right? So we've got a couple of lines there. We don't know if the family member is positive. They don't have any symptoms. So there's really no reason to start clearing everybody out at this point. You want to go through, encourage social distance in and out of work, follow the guidelines, masks, create different distancing areas so that people can safely continue to work in the work environment. And use that questionnaire. How do you feel? Ask the employee each day before they come in, how do you feel today? Any symptoms, any cough, any fever, all this information.
You answered everything, but to their last point, do we require 2 clear COVID tests before coming back to work?
Well, there isn't a positive test in the first place, right?
That is correct.
The employee doesn't have it, the spouse doesn't have it. So there's no reason to even send them for testing. You're just at this point, it's so many layers away that you just want to continue social distancing and safe practices. So they don't even have, there's no positive test to be dealing with.
Next question. An employee has children and their child care is closed during this time. However, there are child care options available in our community. We do not have a remote work option for this employee's role. We do have to provide them with, or do we have to provide them with pay to stay home with their children? Or can we recommend they find alternative child care options?
So you really want to stay away from this one because the potential for discrimination is there. You don't want to tell people how to care for their children. And if they're telling you they've tried, their normal summer camp that they always go to is closed, their healthcare provider is their mother-in-law and she can't do it, then that's what you go with. This person's normal child care process is not available. It wouldn't be right to say, yes, but I know there's a daycare center across town that's open. because that may not be something your employee would have chosen in the first place. So if that employee is telling you, I've done everything I can, my normal childcare situation is not available for me, then you want to provide them the information with the expanded FMLA. Now, keep in mind, you can use intermittent leave there. So you might be able to say, listen, I know you have childcare issues. How can we work this so that we can get you working some of the time? Maybe you can create days on, days off, or maybe there's somebody they can alternate with, another adult in the house, or whatever the case may be. So communicate with the employee, but I would stay away from making recommendations about their specific childcare plans.
Rachel, just a follow-up on this one as well. If there is no option for this employee to work from home, that's not what their role is about. So how do they go about, can they replace the employee, et cetera?
So there's a couple layers here. Number one is we might need to get some more details. What is the industry? What is the business? There is that exemption possibility. If having the position vacant would cause the employer to close and they have less than 50 employees, then it may be a case where we could create an exemption, but that doesn't always apply. So if they're just saying they need somebody in there, that's okay too. You are allowed to hire another person to do that. But when this person is eligible to return, the expectation would be that you return them to the role. So, and you will be paying the wages, the 2/3 wage while they're out on FFCRA, and then also paying for an employee to do the work. So that is, again, that's a business decision. You want to figure out exactly how that looks for you, and that's something you want to do, but you're allowed to do that, sure. You want to, you have to have the work done, so you're putting somebody in that spot, but you still would be obligated to pay the individual who's out on leave.
Okay, this is more just a clarification. Continuous and direct contact typically means within 6 feet for more than 15 minutes on a daily basis. For example, if you sit in a cube right next to somebody, that would be considered continuous and direct. Me in the office at the end of the hall and you all the way at the front desk, that does not constitute continuous and direct contact.
That's right.
That clarification. Next question. If an employee said they were around someone who had symptoms and that person is in the process of getting tested, are they eligible? So the employee is around someone else who is going for testing.
No, it's this one here again. This is what we're seeing quite a bit is people that are 2 and 3 layers away, and you're not eligible until you actually have symptoms yourself and you're going to see the doctor or you're calling your teledoctor. That's when you're eligible. You're eligible if you are positive. If the person next to me is positive, I'm not automatically eligible. That doesn't really, that just doesn't get me auto pay. So we have to make sure that our employees understand, there are layers here. And when it's so many layers removed, that doesn't automatically qualify for sick pay.
Okay, next question. If the employee wasn't feeling well but got tested without getting medical attention, i.e. they did not see a doctor, and the results were positive, do they qualify to be paid?
Yes, anytime there's a positive test result, they qualify. That's one of the easy ones. If the individual tests positive for COVID, they are eligible for 2 weeks of pay with that $511 cap.
The next question is good, and it might need clarification from the school board. So prior to the start of school, I can require all teachers to be tested. Our teachers deal with students with disabilities and medical compromised conditions.
So this is an example where we've got teachers who are going to be in the room with our kids all day without being able to create a 6-foot social distance. So yes, in this example, you could say, all teachers will be required to have a negative test result before the start of school. That's the kind of thing, you know, where you could say that, because you're not saying every employee in the building, you're just saying the teachers. And so it's a by job description. But the other thing I want to say to people is, just because you got a negative test result from a test you took last Monday doesn't mean you don't have it today. So the test results are only as good as the day you took the test. So a lot of what we are going to do has to do with our communication with each other and the symptoms we're showing. So we have to be very careful about that. Yes, you can say, you know, let's make sure we start out clear. But after that, you know, it's kind of all bets are off. We have to see, like, how do people behave? Did they go to the coworker's house for a 10-person party over the weekend? Did they have a family gathering? What happened during the week? Did they go to the grocery store or to Walmart or, you know, to some other situation? So on the day they got tested, you know, that might have been a negative test day, but then they did 6 things where they were exposed for a length of time and potentially at risk. So keep that in mind as well.
Okay, next question. What if an employee has COVID and is out of work for a couple months? How long am I required to pay them?
So under the FFCRA, the sick provision is 2 weeks. So it's a maximum of 80 hours. If somebody is out for 2 months as a result of COVID, you have other options. So you want to take a look at your company's PTO policies, your short-term disability, your any kind of sick pay that you might offer, or if somebody may be out for just considered on a leave of absence, you could do that. But the actual paid time that you have available from this program is going to be limited to 2 weeks. So you would have to look at your own company policies to fill that gap. And it's okay to say, you know, we can't pay you anymore at this point. We've exhausted anything that we have. We want you to return when you're well. Let us know when that is. But you are not obligated to pay them under any of these federal programs in the meantime.
Rachel, I have a question just to expound upon that. If they choose to take a unpaid leave of absence, do all their traditional guidelines apply? The request needs to be in writing. They need to give a date of when they would return. And if they don't return on that date, it's considered job abandonment, so on and so forth.
Yes, of course. You want to follow whatever your company's policies are on a leave of absence and what is precedent. So what happens when somebody needs to take a leave of absence? How do you handle that? Does your company have a policy for that and guidelines? Do you have a procedure in place? Are there forms? And so whatever your company does on a regular basis when there's a leave of absence, that's the process you want to follow. And if you don't have a process in place and you've never had anybody go on a leave of absence, now's the perfect time to say, okay, what does our leave policy need to look like? And then add it in and say, going forward, any leave of absence process we're going to handle like this. If you need help with that, we're here.
Okay, next question. If an employee says they've tested positive, then what can we require from them to return to work? Is a doctor's return to work enough, or should we require 2 negative tests?
Certainly, if a doctor says the employee is eligible to return to work, that should be enough. Because, again, my guess is you are not medical professionals, and so you don't want to be the one to give them the guidelines. And if they've got something from a physician that says this person is eligible and safe and can return to work, then that's what you need. And again, a lot of this is new to all of us, so we're kind of going through these waters together. But when somebody is sick, has had a positive test, they've had symptoms, what the CDC guidelines are, and again, these have changed a little bit too, but the CDC says once somebody goes through the initial 14 days, they've had symptoms, they were positive. Now they come out on the other side, they are symptom free for 72 hours with no medication, they would be eligible to return to work. So asking for a recommendation for a doctor or whatever is okay. You're allowed to do that. It's not required. And again, the CDC is asking us not to send people for doctor's notes, but maybe they can even just have a conversation. If they call their 1-800-DOC number and they say, I went through it, I'm well, I'm feeling better. Can you, give me some clearance to go back to work? And if they send them a text message or give them the message over the phone or whatever, that's enough so that we have some information where they're well and they can return. And again, CDC guidelines will help you with this as well.
Next question. Can you go over again under the FFCRA what % of pay we use and what are the caps?
Kept this slide in because I thought that might come up. So under the FFCRA, the employee has been told to quarantine by a healthcare provider. It is the actual employee. So the employee is sick. The employee has been advised by a healthcare provider to quarantine. The employee is positive or has symptoms and is seeking help. It's affecting the actual employee. This is full pay with a cap at $5.11 a day. The pay is an average based on a 6-month look back, and it is also an average of hours. So it's 2 weeks of pay, but if the employee only works 20 hours a week, then it's 20 in the first week, 20 in the second week. It's not 80 hours total. It's an average of hours over 2 weeks and an average of pay. If the employee is caring for somebody else, so they are caring for somebody who is sick with COVID and doesn't have anyone else to care for them, they are caring for a child whose school is closed or daycare provider is closed, then they would be eligible for 2/3 pay. And under the first part of this provision, it's 2 weeks at that 2/3 pay. The expansion is only for the child care piece. So anyone whose kids are home from school for the summer, their daycare provider is closed, their child care provider is unavailable, those people have 10 more weeks on top of the first 2 weeks available at 2/3 pay. And that's capped at $200 a day. Again, pay is an average and hours are an average.
Okay, next question. For a home service company that has had an employee test positive, do we put the technicians in quarantine? Then we're in direct and continuous contact with the employee. I'm a little confused by the question, but I think I understand what they're asking. They have a home service company, so have an employee who's tested positive. So one, what do they do with the other technicians? And B, what do they do about the homeowners, the customers' homes that they've been in?
Okay, this is a tricky one because, when you've got a technician, for example, who maybe didn't know he was positive and then was in and out of 2 or 3 homes in the course of a day, he may or may not have been in any close, prolonged contact with a homeowner. So, it may or may not be something to have a conversation about. And then with the other employees, did they ride in the truck together all day? Were they in an office together all day? What was the exposure? We have the conversation about employees who test positive, and we've seen so many different things. The other employees freak out and, they're worried that they were exposed and, who is it? What's the name? I'm demanding you to tell me the name of the person. Well, you want to be careful. You don't want to just say who it was. So the conversation has to be, you may have been exposed during the course of your workday to an employee who has test positive. We're going to monitor and pay attention. We've got this questionnaire about symptoms. So you want to have that conversation there. If you believe there was close contact with a homeowner with these technicians, then I think, have the conversation about what your protocol is going to be in this event. But reaching out to the homeowners and say, listen, we wanted to notify you that you may have been in contact. We are not sure, but it's possible. We're just giving you a heads up. and we are following all CDC guidelines. We have safety protocols in place. And if you are sending technicians into homes without PPE, then you want to think about adding that as a protocol on a regular basis. So that if you have somebody who goes into somebody's home, that employee should be completely covered in PPE, masks, gloves, foot covers, shoe covers, whatever necessary equipment and PPE you can provide to them. And then you can say that to your homeowners. Listen, there may have been some exposure, but again, we have followed all safety protocols. The risk is very low. We have taken every precaution and recommendation from the CDC and go from there. So again, when you have these kinds of situations, you want to look at each layer. How much exposure was there? And then have the conversation based on that. And what are you doing about it? Don't just say, we had this exposure. We had this exposure, and here's what we're doing. And here's what we were doing to prevent any issues. So it really protects you on all those fronts.
Next question. It's been somewhat answered, but I'm going to go ahead and throw it out there anyway. If an employee says that they've tested positive, am I allowed to ask for documentation confirming positive test results, or is this where my trust comes in?
You can ask. You can say, do you mind providing me with a screen catch of your results, or would you please send me your results information for my backup documentation? It's okay to ask. Now, if the person says to you, I don't want to give it to you, I mean, there's not really a whole lot you can do with it, but if somebody tells you they're positive, just go with it, because, and it's okay to ask. I think, ask, get the documentation, keep it for your file and for your records. But if somebody refuses to give you documentation and is telling you they're positive, then keep them out for 14 days. That's fine. Thank you for letting me know. Get some acknowledgement on the form that they're telling you they're positive. What date did they get tested? What center did they go to get tested? It's okay to ask that information. So you can get enough information to write down for your document trail.
The goal of the form, everyone, is to put the burden back onto the employee. Let you know that they're being truthful and honest with what they're putting on the form. Okay, next question. Do we pay them their hourly wages, or is there some sort of average? We've already talked about that, average hours, average wages for the week.
And this is a good point. So especially if you've got technicians or people that get performance type pay or commissions or any kind of additional pay, it's not just their flat hourly rate. So what you're going to do is take a full look back of a 6-month window and get an average number that you can create an hourly rate for. And that's the rate you pay. So you would pay, let's say you've got a full-time employee who is one of your technicians, they get performance pay and commission. And so you're going to get your hourly average, maybe it's $23 an hour. And that's the number you're going to use for 40 hours in the first week and 40 hours in the second week at that average.
Okay, the next question, this is back to the teachers. They would like to know if they, back to the question about asking teachers to be tested prior to work. Could it be a COVID test or an antibody test? Antibody testing is done automatically when donating blood, so they could be doing good at the same time.
So the antibody testing at this point, I don't think is a reliable enough guideline for you to implement on a regular basis. This is just information that we aren't there yet. Ultimately, we might be, but again, you're thinking about asking a medical test. You're going to incorporate a medical test, which I think is risky territory. And right now, there have been so many issues with the antibody tests out there, not to mention they're pretty expensive. So that's not a route that I would add just yet because we don't have solid information about the results. It would make more sense to stick with the testing side because we do have information that the tests are a little bit more accurate. Now, while they might take a long time to get back, there is more accuracy on the actual test itself. So again, you want to be careful about asking somebody to do a medical procedure. Not medical procedure, but to take a medical blood test of some kind as a requirement for work. So we want to be careful about that.
I would also imagine the school districts have super strict guidelines for returning next year. I mean, I would certainly check with the school board and see what they have to say. Also, Rachel, could you touch upon the testing as far as who's paying for these tests? Again, the teachers, if I'm requiring you all to be tested, am I paying for that? Is it on you to pay for yourself?
So under the FFCRA, there should be no co-pays, there should be no fees or co-insurance applied. These are covered under the FFCRA. If somebody does not have insurance, and it's a provision for your insurance company so that the insurance companies are paid under the FFCRA for the testing, not the individual people. So when you go to get a test, it should be free of charge for you. And when you're requiring somebody to go get a test, again, you want to be careful because there should be no fees from the service when you go to get the test based on the FFCRA. I have heard conflicting stories. I have heard people say they got charged when they got there or whatnot. There shouldn't be. So if you're at a state certified testing center, then they would be following FFCRA guidelines for testing and for payment. If somebody does not have insurance coverage, then the FFCRA coverage is for Medicaid. So the Medicaid is paying for the testing. So there shouldn't be people charged when they go get a test. But again, I have heard some conflicting stories, so maybe ask that question if you make an appointment. Make sure you're at a state-funded, state-approved center and, go from there. There shouldn't be payment for testing.
That is actually all the questions I have. I don't know if anybody wants to type any more in, but certainly type in your email address. Those who have already done that, I do have yours. So any questions? Throw them out. Email addresses, go ahead and put those in too.
Yeah, thank you so much, guys. We really have enjoyed connecting with all of you during these coffee breaks. And if you have a particular topic you would like to hear or you would like to get some coverage on in one of our coffee breaks, put that in the chat as well, and we are happy to give you that information. The whole team at CertaPay appreciates and values you and all of our business owners and our clients out there. So thank you again for your time this morning, and I hope everybody has a safe and happy July 4th weekend.